I'm Dr. K.R. Paliniswamy, Head of Gastroenterology, Apollo Hospital, Chennai. Inflammatory bowel disease is getting more common in our country. There are two components of inflammatory bowel disease. One is ulcerative colitis, the other one is Crohn's disease. When you look at the symptoms, when one encounters the ulcerative colitis, where one can have stool frequency, diarrhea, they can pass blood in the motion, or they can pass mucus in the motion. At times when the disease is severe, they can have pain in the abdomen. These are the common symptoms of a patient with ulcerative colitis. But when you look at the Crohn's disease, the symptoms can differ. The ulcerative colitis can affect predominantly the large intestine, whereas Crohn's disease can affect any part of the digestive tract. But commonly it affects the distal part of the small intestine, that is ileum, terminal ileum, and initial portion of the colon, that is the cecum and ascending colon. When you consider the symptoms, they can present with loss of appetite, pain abdomen, loose stools, diarrhea, and also weight loss. These are the common symptoms for the Crohn's disease. But when the Crohn's disease is very severe, sometimes they can present with like a bowel obstruction, and that can happen only in a small proportion of the patients. These are the common symptoms with which one can present with ulcerative colitis and Crohn's disease. But once the patient gets affected with Crohn's disease or the ulcerative colitis, when you look at the treatment options, initially first let me start with ulcerative colitis, where the treatment is, once the diagnosis is confirmed, we start with the initial drugs called the mesalamine. The mesalamine, the mild to moderate disease, mesalamine itself can offer the symptom control, and sometimes it can even lead on to remission of the disease. But when the colitis is moderate to severe, where we may have to consider the treatment options, like we can start with steroids initially to induce remission and maintain the remission with mesalamine. But at some situation, moderate to severe disease, where we can induce remission with steroid and maintain the remission with immunomodulators like azathioprine. Apart from the pharmacotherapy of ulcerative colitis, where you might consider other options like diet modification. Like dietary, generally we recommend more fresh food, avoid all junk food, and more water, and regular physical exercise, and keep the mind calm, good sleep. Maintaining a good lifestyle, that also will help in the management of ulcerative colitis. And regarding the Crohn's disease, of course, in general, the management, the lifestyle management also, this is also important in the case of Crohn's disease also. Here again, they have to consider the dietary modification, like more fresh food, more water, exercise, and good sleep. These are the most important things which will help in the management. In a severe form of Crohn's disease, where one has severe inflammation and compromised the small intestinal passage, where sometimes we recommend enteral nutrition that helps in the management. When you look at the pharmacotherapy for the management of the Crohn's disease, in a mild disease, generally here the mesalamine does not work, and the treatment options are we start with, in a severe disease, start with steroids and then follow with the immunomodulator like azathioprine. But in a moderate to severe disease, where we may have to consider biologicals like the anti-TNF, anti-TNF agents, and there are many newer biologicals on the market. And in our country, we use infliximab and quidolizumab. Also now the ustekinumab. These are the biologicals available. They offer a good, when you start the patient on the molecules, they get a good symptom improvement, and sometimes they even go in for the remission.